You've been told your blood pressure is high, maybe you've been told to cut the salt, maybe you've been put on medication, maybe you've done both and your numbers still haven't come down the way they should. And nobody has asked you the obvious question, what if salt isn't the reason? For most people with high blood pressure, the standard advice is the same: reduce sodium, lose some weight, take your pills. And for some people, that works. But for millions of others, it doesn't. Their blood pressure stays stubbornly high, or it responds to medication but never resolves, because the actual cause was never identified in the first place. What most people don't know is that blood pressure is controlled by three systems working together: cardiac output, blood volume, and vascular resistance. And there are at least 10 different mechanisms that can push one or more of those systems out of balance, mechanisms that have nothing to do with your salt shaker, and that most doctors simply don't have the time to investigate in a 10-minute appointment. In this video, I'm going to walk you through all 10 of them. Some of them will surprise you, some of them will frustrate you, and at least one of them I'm almost certain is going to make you stop and think, that might be me. Because if you've been treating your blood pressure without addressing the real cause, you're managing a symptom while the driver sits untouched. Hi, I'm Dr. Alex. I'm an emergency medicine doctor, and after nearly 10 years working in the AANDE, I've seen what uncontrolled blood pressure does to people: hypertensive crises, strokes that arrive without warning, heart failure that was building silently for years. And what struck me over and over again was how many of those patients had been on medication, had been following the standard advice, and still ended up in front of me because the real driver had never been found. My goal now is to help people understand what's actually behind their blood pressure so they can address it properly and avoid the emergency department altogether. Now, if you're watching this, you're already taking your health more seriously than most people ever will. And I want to make you a promise. I promise to keep creating the most helpful, science-backed videos I possibly can, grounded in real research and in the realities of what I see in clinical practice, to help you prevent the diseases that fill emergency departments every single day. All I ask in return is that you give this channel a chance. Hit the subscribe button and the like button right now. If you get to the end of this video and you didn't learn something new, feel free to unsubscribe. No hard feelings. But if you give me your time, I'll give you everything I've learned from over a decade in frontline medicine. So please subscribe, like, and let's get into all 10. Before we go through the 10 hidden causes, let me give you a quick framework so you can understand why each one raises blood pressure. There are only 3 forces that determine your blood pressure at any moment. The first is cardiac output, how much blood your heart pumps per minute. The second is blood volume, how much total fluid is circulating in your system. The third is vascular resistance, how tight or relaxed your arteries are. Every single cause of high blood pressure works by pushing one or more of these 3 forces upward. Once you understand that, the 10 causes I'm about to describe will make immediate intuitive sense. This is the most underdiagnosed driver of high blood pressure in adults over 45. Obstructive sleep apnea causes your airway to partially or fully collapse during sleep, sometimes hundreds of times per night. Each time it happens, your blood oxygen drops and your brain triggers a surge of adrenaline to wake you up just enough to start breathing again. That adrenaline surge activates your sympathetic nervous system, spikes your heart rate, and constricts your blood vessels. When this happens repeatedly throughout the night, your sympathetic nervous system never fully resets. It stays in overdrive during the day. The result is chronically elevated cardiac output and vascular resistance, both of which push blood pressure up around the clock. Research published in the journal Hypertension has shown that up to 50% of patients with resistant hypertension, meaning blood pressure that doesn't respond to 3 or more medications, have undiagnosed sleep apnea. If you snore heavily, wake up feeling unrefreshed, or your partner has noticed you stop breathing during sleep, this needs to be investigated. Stress is often dismissed as a soft factor, something that's hard to quantify and therefore easy to ignore. But chronic psychological stress has direct measurable effects on blood pressure through your hormonal system. When you're under sustained stress, your adrenal glands produce cortisol and adrenaline continuously. Cortisol raises blood sugar, promotes insulin resistance, increases sodium retention in the kidneys, and stiffens arterial walls. Adrenaline increases heart rate and constricts blood vessels. Together, they hit all 3 arms of the blood pressure equation simultaneously. This isn't about having a bad day at work. This is about months or years of financial pressure, caregiving burden, relationship conflict, or health anxiety that keeps your nervous system locked in a state it was only designed to occupy for minutes at a time. Your body can't distinguish between running from a predator and worrying about your mortgage. The hormonal response is the same. This is one that most people have never heard connected to blood pressure. Your gut microbiome, the trillions of bacteria living in your intestines, plays a direct role in regulating vascular tone. Beneficial gut bacteria produce short-chain fatty acids like butyrate, which support endothelial function and help keep blood vessels relaxed. When the balance of bacteria shifts toward inflammatory species, whether from antibiotic overuse, poor diet, or chronic stress, this protective mechanism breaks down. Research published in the European Heart Journal has demonstrated that individuals with hypertension show distinct changes in their gut microbiome composition compared to those with normal blood pressure. Gut dysbiosis also increases intestinal permeability, allowing bacterial toxins to enter the bloodstream and trigger systemic inflammation, which further damages the endothelium and reduces nitric oxide availability. Your gut health and your blood pressure are more connected than most people would ever suspect. These two minerals are essential for healthy blood pressure, and the majority of adults in the Western world are deficient in at least one of them. Magnesium is required for vascular smooth muscle relaxation. Without adequate magnesium, your arteries stay constricted, increasing vascular resistance. Potassium directly counterbalances sodium in the kidneys, helping your body excrete excess sodium and reduce blood volume. The problem is that modern diets, particularly those built around processed food, are catastrophically low in both. A single ready meal might deliver a full day's sodium, but barely a fraction of your potassium or magnesium needs. Studies published in the American Journal of Clinical Nutrition have shown that increasing potassium intake to recommended levels can lower systolic blood pressure by 4 to 8 points, which is comparable to some first-line blood pressure medications. Before adding another drug, it's worth asking whether these fundamental mineral deficiencies have been addressed. I've covered insulin resistance in depth in other videos, but it deserves a place on this list because its effect on blood pressure is so powerful and so commonly overlooked. When your cells become resistant to insulin, your pancreas produces more to compensate. That chronically elevated insulin signals the kidneys to retain sodium, increases sympathetic nervous system activation, and directly impairs endothelial nitric oxide production. That means insulin resistance raises blood pressure through all three mechanisms at once. It expands blood volume through sodium retention, it increases cardiac output through sympathetic drive, and it increases vascular resistance through endothelial dysfunction. And it does all of this while fasting glucose often remains completely normal on standard blood tests. This is why so many patients with metabolic syndrome have blood pressure that doesn't respond adequately to medication alone. The hormonal driver is still active underneath. Your endothelium, the inner lining of every artery in your body, is not just a passive tube. It's a living, active tissue that produces nitric oxide to keep your blood vessels relaxed and compliant. But nitric oxide production requires a stimulus, and the primary stimulus is physical movement. When blood flows through your arteries during exercise, it creates shear stress on the endothelial surface, which triggers nitric oxide release. When you're sedentary for long periods, that stimulus disappears. Your endothelium becomes sluggish and dysfunctional. Nitric oxide production drops, your arteries stiffen and lose compliance, vascular resistance climbs, and blood pressure rises. This happens independently of your weight, your diet, and your stress levels. You can eat perfectly and still have elevated blood pressure simply because your endothelium hasn't been stimulated by movement. Research in the British Journal of Sports Medicine has shown that even modest regular exercise reduces blood pressure more effectively than many people realize, primarily through this endothelial mechanism. This one seems counterintuitive. You might think that dehydration would lower blood pressure because there's less fluid in the system, but the body's response to chronic mild dehydration actually does the opposite. When your blood volume drops even slightly, your kidneys activate the renin-angiotensin-aldosterone system, which tells your body to retain sodium, hold on to water, and constrict blood vessels to maintain adequate pressure to your vital organs. If you're consistently not drinking enough water, this compensatory system stays active, your vascular resistance stays elevated, your kidneys stay in retention mode, and your blood pressure sits higher than it would if you were simply well hydrated. This is particularly common in older adults, who often have a reduced thirst sensation and unknowingly operate in a mild state of chronic dehydration for months or years. What makes this particularly insidious is that chronic mild dehydration doesn't feel like thirst. You don't walk around feeling parched. Your body adapts to the lower fluid state and stops sending urgent signals. Meanwhile, the hormonal compensation continues in the background, keeping your vessels tight and your kidneys locked in retention mode. Something as simple as drinking an additional glass or two of water throughout the day can measurably reduce this compensatory response and take pressure off the system. This is the one that catches people off guard the most. Several commonly used over-the-counter and prescription medications can raise blood pressure as a side effect, and many people are taking them without realizing the connection. Non-steroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen and naproxen, inhibit the production of prostaglandins that help relax blood vessels and promote sodium excretion. Regular use can raise blood pressure by 5 to 10 points and can blunt the effectiveness of blood pressure medications you're already taking. Certain antidepressants, particularly SNRIs, can increase noradrenaline activity and raise blood pressure. Decongestants like pseudoephedrine constrict blood vessels directly. Oral contraceptives can raise blood pressure in some women through hormonal effects on the renin-angiotensin system. And even some herbal supplements, including licorice root, can cause significant sodium retention and blood pressure elevation. If your blood pressure is elevated and you're taking any of these regularly, it's worth having a conversation with your doctor about whether they might be contributing. You don't need to be overweight for this one to apply to you. Visceral fat is the fat stored deep inside your abdominal cavity, wrapped around your liver, kidneys, and intestines. Unlike subcutaneous fat, which sits under the skin and is relatively metabolically quiet, visceral fat behaves like an endocrine organ. It pumps out inflammatory cytokines, disrupts insulin signaling, and directly contributes to endothelial dysfunction. People with a normal BMI can still carry dangerous levels of visceral fat, a condition sometimes called thin outside, fat inside. The inflammatory compounds released by visceral fat increase vascular resistance, promote sodium retention, and accelerate arterial stiffening. A waist circumference above 40 inches in men or 35 inches in women is a strong indicator of elevated visceral fat, regardless of what the scale says. This is one of the reasons why two people with the same weight can have dramatically different blood pressure profiles. This is the cause that gets the most skepticism, but the research behind it is remarkably strong. Chronic loneliness and social isolation activate the same sympathetic nervous system pathways as physical danger. Your body interprets social disconnection as a threat, and it responds accordingly. Cortisol rises, adrenaline increases, heart rate goes up, blood vessels constrict, and inflammation increases throughout the body. A landmark meta-analysis published in Heart found that social isolation and loneliness were associated with a 29% increased risk of coronary heart disease and a 32% increased risk of coronary heart disease and a 32% increased risk of stroke. These effect sizes are comparable to well-established risk factors like smoking, physical inactivity, and obesity. For adults over 60, particularly those who have lost a spouse, retired, or moved away from their social network, loneliness isn't just an emotional problem. It's a cardiovascular risk factor that raises blood pressure through the exact same autonomic and hormonal pathways as chronic stress. It deserves to be taken just as seriously. So here's the picture that emerges when you see all 10 together. And this is the part I really need you to understand. High blood pressure is not one disease with one cause. It is a final common pathway produced by multiple upstream drivers, most of which are never investigated in routine healthcare. Sleep apnea, chronic stress, gut health, mineral deficiencies, insulin resistance, physical inactivity, dehydration, medications, visceral fat, and social isolation. Each of these pushes one or more of the three blood pressure forces upward. And in most people, it isn't just one of them, it's two, or three, or five, acting together. The reason blood pressure medication works, but often doesn't resolve the problem, is that the medication addresses the pressure, not the cause. An ACE inhibitor lowers vascular resistance. A diuretic reduces blood volume. A beta blocker slows the heart rate. But if your blood pressure is being driven by untreated sleep apnea, chronic cortisol elevation, and magnesium deficiency simultaneously, the medication is fighting against three active forces that haven't been touched. This is not your doctor's fault. The system gives them 10 minutes per appointment and a limited set of tools, but it is the reality, and understanding it puts you in a position to take action that most patients never do. So what do you actually do with this? Here's my practical advice, and it comes directly from what I've seen work in real patients. First, go through this list and honestly identify which of these 10 causes might apply to you. Most people will recognize at least 2 or 3. Write them down. That's your starting point. Second, prioritize the causes that are most actionable. If you suspect sleep apnea, get a sleep study. It's one of the single most impactful things you can do for your blood pressure. If you're taking NSAIDs regularly, talk to your doctor about alternatives. If you're sedentary, start moving. Even 30 minutes of brisk walking most days of the week will stimulate your endothelium and improve nitric oxide production measurably within weeks. Third, address the foundational factors that affect multiple causes at once. Regular physical activity improves insulin sensitivity, reduces visceral fat, strengthens vagal tone, stimulates the endothelium, and reduces cortisol. Whole food nutrition, rich in potassium, magnesium, and fiber, addresses mineral deficiencies, supports gut health, and reduces the inflammatory burden on your arteries. Quality sleep supports parasympathetic recovery, reduces cortisol, and improves every metabolic marker downstream. Fourth, ask your doctor for deeper testing. Request a fasting insulin level, not just fasting glucose. Ask about a sleep study if you have risk factors. Get your magnesium and potassium levels checked. Ask about your waist circumference and what it means for your visceral fat profile. These are simple, available tests that can identify causes your routine blood work was never designed to detect. And one essential note, if you're currently on blood pressure medication, do not stop or change your dose based on this video. Medication saves lives, and it continues to work while you investigate and address the underlying causes. The goal is not to replace medication, it's to resolve the drivers so that medication can eventually be reduced under medical supervision. That conversation always happens with your doctor, not with a screen. In the emergency department, blood pressure is not an abstract number. It is a force I see doing real damage in real time. Strokes caused by years of uncontrolled pressure, heart failure from decades of elevated afterload on the cardiac muscle, kidney failure from chronic hypertensive damage to the renal vasculature. Every one of those patients had blood pressure that could have been managed more effectively if the actual cause had been found earlier. The patients who reverse their hypertension, and I mean truly reverse it, are the ones who go beyond the medication. They get the sleep study, they address the insulin resistance, they move their bodies, they fix the mineral deficiencies, they reduce the chronic stress, they deal with the loneliness, and gradually the drivers switch off, the medication doses come down, the numbers stabilize naturally, not because the medication stopped working, but because the system underneath started working again. Here's the take-home message. Blood pressure is not a disease in itself, it's a signal. It's your cardiovascular system telling you that one or more of the forces governing it are out of balance. Treating the signal with medication is essential and life-saving. But if you want to resolve the problem rather than manage it, you have to find the cause. And the cause is almost never as simple as too much salt. The 10 hidden drivers I've laid out in this video cover the vast majority of what actually pushes blood pressure up in adults over 45. Most of them are modifiable. Most of them are diagnosable with tests that already exist. And most of them respond to interventions that are well within your control. That's not a reason for frustration, that's a reason for genuine optimism. Because it means you are not powerless against this, you just needed the right map. 10 hidden causes: sleep apnea, chronic stress, gut dysbiosis, magnesium and potassium deficiency, insulin resistance, sedentary endothelial dysfunction, chronic dehydration, medications and NSAIDs, visceral fat, and loneliness. Each one of them pushes blood pressure up through a mechanism that standard advice and standard checkups were never designed to catch. If your blood pressure has been stubbornly high despite doing what you've been told, it's not because you failed, it's because the real driver hasn't been found yet. Now you know where to look. If this video changed how you think about your blood pressure, please hit the subscribe button and the like button. Every subscribe and every share helps this channel reach more people who are struggling with the same question: why isn't my blood pressure coming down? And if there's a health topic you'd like me to cover next, drop it in the comments. I read every single one. Thank you for your time, and I'll see you in the next video.